Well, weight loss drugs have been all the rage in India of late. We've had different launches that have come in. Some people have also been taking drugs like Ozempic, buying them from the black market since it's not officially launched in India. To get more perspective on what this launch can really do and whether it will be an inflection point for the entire weight loss drug market in India, we're joined by Dr. Ambrish Mithal, who is the chairman and head of endocrinology and diabetes at Max Healthcare. Welcome to the show, Dr. Mithal. Let's start by talking about these weight loss drugs. Conversation on weight loss drugs in India focus on names like Ozempic and now more recently Eli Lilly's Mounjaro. Now we have Wegovy. Can you break down for us what exactly is the difference between the three of them?
Actually, Ozempic and Wegovy are exactly the same drug. There is no difference between them. Ozempic is it's available in little different strengths and doesn't go up to 2.4 milligrams, whereas Wegovy goes right up to 2.4 milligrams. So both are semaglutide. The semaglutide is the molecule. Ozempic has been positioned more because of slightly lower dose for diabetes, and Wegovy has been positioned more for obesity, but both work for both. There's no real difference between the two. As far as Mounjaro is concerned, that's a slightly different drug. All these drugs belong to the GLP-1 class of drugs, which means they act via the GLP-1 receptor. Mounjaro acts via GLP-1 and GIP pathway, both. So it has an additional pathway. By far, the most important pathway is GLP-1. Mounjaro has a little different approach in the sense that it targets both GLP-1 and GIP.
Right. And Ozempic currently is not available in India, but there is surely a black market for it. Now, with a drug specifically that is meant for weight management, do you foresee the premiums that are being charged for Ozempic coming down in the black market?
Well, as I said, Wegovy and Ozempic are the same drug manufactured by the same company. So there is no reason for anyone to go for any gray market or black market kind of stuff. When the original stuff is available or is going to be available soon in India, there is no, I think the gray market or black market will just end.
Right. We also know that when it comes to India, weight loss, obesity is widely recognized as a medical problem, but it is also a lifestyle issue. Do you feel that with Wegovy we are moving towards a medicalized weight loss culture, and is India really ready for it?
I think that's a great question, actually. Remember that managing obesity is a multi-pronged approach. And we are only talking of treating obesity in those who come to our clinics, those who come to the hospitals, or those who really want treatment for their weight. So when we talk of treating obesity in those where obesity is at a level where it cannot be managed by diet and lifestyle, or where people have failed to manage it by lifestyle measures, then of course these drugs occupy a very, very important place. I don't think these drugs will eradicate the obesity problem of India or any country, but I do think they will definitely aid doctors in managing their obese patients. So cultural shift, yes. I don't want, to say that everyone who's overweight is actually diseased. I think that's a bit much. But yes, we have to think think of obesity as something that has to be treated and not just accept it, as something that it's just there and, it happens and it's in the family and I'll take care of it. We have to address it as something that requires treatment. Now, that treatment may be just lifestyle, exercise, etc., or it could require actual medication.
Right. Thank you so much, Dr. Mithal, for joining us on the show. Your insights have been